if you just join us now, thank you so much. And I just want to check quickly if we've got audio available, if we have contact with you. If you just join us now, welcome. We are busy signing up people, and we will start the presentation at 11 o'clock. Good morning. So there's audio feed. Once again, welcome. If you just joined us now, let me explain to you exactly how the platform works. It is called a webinar, and we're having a live broadcast. Thank you so much for joining us, affording us your time. I would just want to familiarize you with the settings. Stefanus, I can see you going on live now, and you can hear us fine. We have settings on the right-hand side, and there's a chat facility in which we encourage people to have an interactive session as soon as we convey the information at hand. We will discuss safety and health and safety regulations with regards to legislation with a soft opening from level 5, a complete national lockdown, to level 4, soft opening, and the regulations will be gazetted. We'll also keep you up to date. We have all your email addresses, and we'll definitely assist in all the questions you might have during the session. Thank you so much for joining us. We will start the live broadcast at exactly 11 o'clock. And we're just waiting for some more people to get on board, as we are eager to facilitate a series of sessions. And we want to invite you to also take part in future conversations with regards to the labor law challenges that we might face, and with different legislation, how we are going to implement that. Barry, thank you. I see you also on air, and all the other participants in this webinar. Thank you so much for joining us this morning. As I said, if you have any problems with regards to your signal, I encourage you to drop a line, and we have a standby on our side, which will facilitate your connection again. Leanne, Leanne, at halogroup.co.za, or you can call her at 062 335 4205. During our testing for this broadcast, we have noticed that due to the excessive internet usage, you have or might have a drop in signal. Do not worry. We will place you back on the seminar, the webinar as well, and we will answer all your questions and help you. We are suffering from that now, as each and every business goes online, and we're having some difficulties. But do not worry. We should have a smooth ride, and I'm excited to facilitate this webinar live at 11 o'clock with you. There's about 3 minutes time, so take some coffee, have a break, and we'll definitely start chatting and facilitating this interview at 11 o'clock. I just want to remind you, if you have any questions with regards to your connection, if you do not have audio or visual at this stage, please do not hesitate to contact Leanne. I just want to spell that for you. It's Leanne at Halo Group, HALO group.co.za. Please give her a call as well, or WhatsApp. Just drop her a text. It's at 062 335 4205. I'm Jan-Hendrik Kleynhans, and I'm eager to facilitate this session with regards to the labor legislation, as well as the health and safety factors that comes into play as the complete national lockdown will be lifted, with regards to the speech of the President of South Africa, Mr. Cyril Ramaphosa, and we are eager to await the publication in the Government Gazette. We have your email address, and most definitely we'll get back to you. Barry, I see you've got a question. You're asking, must we make our notes or be getting a summary of the important facts in the different levels? We'll definitely get back to you, and we'll also send you an email with regards to the highlights of this meeting with regards to the main points as well as the legislation that comes into play. Thank you. That's a very good question. Should you experience any technical difficulties, please do not hesitate to contact us. You can either drop us a text on your right-hand tab, and also do not hesitate to contact Leanne or Leon at Halo Group, Leon, Leanne, at halogroup.co.za. The telephone number is 062 335 4205. Yeah, it's a job law, labor law specialist for employers. And my name is Jan-Hendrik Kleynhans. We are waiting for a few minutes to get everyone on board. I can see there's a whole lot of people getting on board now, and I'm eager to have a liftoff with you and having a look at legislation and how health and safety factors will come into play with the level 4 easing of the national lockdown. Please familiarize you with the forum and the platform that we are busy facilitating. On your right-hand side of the screen, there's a chat facility. Please open that up. We encourage you to have an interactive session with us, asking questions as we go through the details. Also, Barry, which asked a good question, and with regards to the fact, will we be sending out notes on the main highlights of this talk? Definitely we will. We have all of your email addresses, and we encourage you to participate in this session. Gail Gerber asked, as I'm at home, the sound is dreadful. Please add me to the summary email. Let me just check if I can just set the sound here. Can you hear me now? Just confirm if the sound is working or not working. If you can just give us a heads up there. If everyone can hear me, that'll be great. Just checking quickly if everyone is happy with the sound. Sorry about that, Gail. If you can just confirm with me that you can hear us fine and you are happy with the audio quality, the visual quality, as Leon, Leanne, is on standby. Matt Bertram says the sound is fine for me. Matt, thank you so much. Audio is clear. Henry, thank you. Audio is clear. Barry, Marius van den Berg, sounds good on his side. Maybe just check your audio settings. Marley, thank you so much for getting back to us and letting us know about the sound. All right, I think it's time to start, and I trust everyone's on board. Great stuff. Lewin, thank you for giving us some feedback. I'm glad everyone's on board. What an honor and a privilege for me to start this meeting with you, and that with amongst and amid a lot of uncertainty with South Africa on the verge of going live with a soft lock, as we know, the level 5 lockdown. National lockdown will end on the 1st of May, which is Friday, as the President of South Africa will facilitate this lift of the lockdown. And there's much uncertainty. One thing we definitely have known over the past couple of weeks is that the new normal will definitely change, and what needn't be normal in the past is definitely a new standard which will be raised. I'm Jan-Hendrik Kleynhans, a legal expert with regards to labor law from the company Job Law, which is a labor specialist with regards to labor law, and especially with specialists having a standby on the employer side. We represent employers. With me, I've got Natie Kroukamp from the company Safety at Work. Natie is a health and safety specialist, which specializes in health and safety issues. And I'm going to ask him to just say a few words. Natie, welcome. Can you just put on your mic, Natie? Good. We're just going to wait for Natie to be connected there. I can not hear him properly. But as I said, we are definitely going to work through a few legal issues, and definitely some legislation you have to take note of. And first of all is the Occupational Health and Safety Act, Act 85 of 1993. There's definitely the compensation for occupational injuries and diseases. Most of you guys know it as your COIDA or COID registration. The act that comes into play, there's Act 61 of 1997. And the protection of personal information, that works itself in there as well. and you have to take notice of that. It comes into play with the information that you will have at hand once your employees get tested. And of course, the whole legislature issue with regards to making stuff a lot interesting, a lot more interesting at the moment, is the Disaster Management Act of 2002. And that comes into play with a huge impact. We will also discuss how that interlinks with the Basic Conditions of Employment Act, Act 75 of 1997, and how that also implies on and implements on the Labour Relations Act, which defines when someone is an employee, especially with regards to the current situation. Natie, do I have confirmation that you are on board? Great, I can hear you, and we're getting you also connected. Thank you so much for joining us. Yeah, I just want to facilitate you quickly with the platform. On your right-hand side, you have the chat tab, and we encourage you to have an interactive session and letting us know what exactly are your ideas. Natie, thank you so much. Welcome, and we are eager to hear from you.
Good morning, Jan-Hendrik, and good morning to the listeners. Thank you for having me.
Natie, as we are eagerly awaiting the lifting of the current hard lock or national lockdown, we are looking at some challenges. And with the current legislation we have dealt with before, the Occupational Health and Safety Act, we haven't really touched on the regulations for hazardous biological agents, which comes into play as a regulation now. Can you just explain to us exactly how this incorporates the situation currently at hand?
Yes, Jan-Hendrik, that is, of course, a mouthful as far as the name of the regulation is concerned. So let's just call it the HBA for the lack of another word. The biological agent is a microorganism, and it is commonly known as a bacteria, virus, or parasites. And up until now, only laboratories and food-related businesses would be familiar with the regulations. Nevertheless, since the COVID-19 have hit our shores, and we now have to deal with it. Obviously, it falls under the category of a virus, and that brings the regulation. In other words, the OSH Act actually triggers this document, this regulation now. In essence, sorry.
No, we are eagerly awaiting the various lifting of restrictions, the COVID-19 risk-adjusted strategy, as the government puts it, and the systematic process of lifting the lockdown. I think that is the concern of most employers also subscribed on this platform at the moment.
Yes, the COVID-19 risk-adjusted strategy is a systematic process which is lifting the lockdown, and this is, if you look at the document, you can see that the government is lifting strategically depending on the risk of the various business groups from level 4, which is supposed to kick in on the 1st of May, gradually then towards whenever that may be, when level 1 hopefully will arrive at some stage, which indicates that we will have a semi-normal situation where everybody can move around accordingly.
I just want to also familiarize the subscribers that have just connected with us. There's quite a few just getting on at the moment, and we are live broadcasting with regards to health and safety issues. I'm your legal expert in labor law as a specialist, Jan-Hendrik Kleynhans from the company Job Law, labor law for employers. And I just want to familiarize you with the settings. If you have any problems with connectivity and you are suffering from not connecting, not hearing audio or visual, please contact Leanne at Leanne, L-E-A-N-N-E, at the Halo Group, or at halogroup.co.za, L-E-A-N-N-E, at halogroup.co.za. She also has a contact number, 062 335 4205. You'll see on your right-hand side tab, there's a message from Adrian Stein, which also helps you to connect and reconnect there. Natie, you just explained the regulations for hazardous biological agents, which comes into play as a regulation was also added to the Occupational Health and Safety Act. Let's get practical with regards to what we are dealing with here. What are the basic requirements, the most basic requirements for an employer to open business as the lifting of level 5 will commence on the 1st of May?
Well, Jan-Hendrik, you've already mentioned the Occupational Health and Safety Act, which one must understand that the Occupational Health and Safety Act doesn't disappear now. It still works hand in hand with all the other regulations, and in this case now let's call it the HBA, as well as the risk-based strategy of the government. So all these documents must be read in conjunction with each other. And in this case, if I can just go back to the HBA, the biological agents regulations requires the employer now to fulfill certain functions, and one of them being informing the employee of their role and duties and the risks that they may be exposed to and how to control those risks. The other would be as far as other persons, in other words, your visitors and being your customers, as well as your service providers must be informed of their risks. Risk assessments must be carried out. Monitoring the exposure of the workplace, in this case the virus, as far as health and hygiene is concerned. Medical surveillance, if you have got a situation where you need to monitor the employees. Keeping records, in this case, what is important to mention is that records, whatever records you now generate under the HBA, must be kept for 40 years.
Can I just cut in at the moment, Natie, and just bring you back to the physical equipment? As shops open and businesses open, what is the minimum requirements at the moment with regards to sanitizing PPE equipment?
Okay. Before you open your shop again, I suggest that you look at the manner in which you're going to open, and I think what needs to be mentioned and keep on mentioning is that the overall reason why we're having this discussion is, of course, to mention to control infection of the COVID-19. Everything is going about this, and it is so important that, you know, a business owner will manage a lot of risks on his place, but one risk that he cannot afford to have is an infection. It can close the business. So the business owner should then assess the business of, first of all, how are you going to control the infections coming onto your premises? Secondly, you need to look at what activities and what equipment is being used at the in your shop or your business, and how are you going to prevent the infection of, first of all, getting into your business, and if you have a situation, how to deal with that. But so, prevention is, of course, more important at this stage than anything else, and that would be where the PPE is used, or disinfection and sanitization.
If I can just also highlight what you're saying, and to familiarize yourself with the current legislation, the Labour Relations Act describes when a person is actually an employee, and employees are regarded as people in supportive roles to a service provider, conveying essential services, which is also obligated to adhere to the health and safety aspects of this conversation. We're also having a look at the Occupational Health and Safety Act, Act 85 of 1993, which in fact states that it requires every employer to provide, also maintain a reasonably practicable that is the word, practicable working environment, and also to be productive. So that also needs to be taken in mind. And it also places a dual yoke as well on the employees to keep themselves safe, and they are sharing this responsibility as we're taking risks and dangers, and we're making it calculated risks. So there's a definite responsibility as well on the employees, having a duty to being informed with regards to the virus. The strain of the virus is SARS-CoV-2, which with infection causes COVID-19, which we are facing now, and which is interesting as well. There was also a question earlier from one of the subscribers that they asked that, does it mean that the employee has a duty to inform his or her employer of the COVID-19 status? Yes, most definitely. You have to let your employer know about your COVID status, as well as the risk having been exposed to COVID-19 case, having been exposed to a situation where people might have been exposed, and in order for the employer also to safeguard the rest of the work crew, and that with the current legislation. However, it is critical to keep in mind that the regulations under the new Disaster Management Act of 2002, which comes into play, also Section 115 or Section 11, subsection 5 says that it's a criminal offence to publish statements through any medium with the intention to deceive about the COVID-19. So Natie, how does an employer safeguard his or her business? Firstly, with the chance of infections that we've mentioned earlier in the workplace, and what happens when post an infection, there's infection that occurred? How do we handle that situation? What do you suggest?
Well, the prevention part, one would, of course, look at possible screening, and many companies will, along with the screening, and when I talk about screening, I'm talking about the thermometer type of, in other words, detecting fever.
Thermal scanner.
Thermal scanner. So that would be the first manner in which you can prevent infection coming on board. Along with that, many companies use a health check form. In other words, a few very pertinent questions will be asked. For argument's sake, do you have a fever? Have you been in contact with somebody that may have been infected? So at that stage already, the employer or the business owner can decide whether that person should come onto the premises or not. As far as the employees are concerned, this is a different situation altogether. And it has not only a safety angle on it, but also a labor relations angle in terms of how do you deal with illnesses and so on, so sick leave, etc. But there are 4 different scenarios which the NICD have laid out in how to deal with this. This is consistent with the World Health Organization's methodology and practices. So I suggest if an employer have a possible infection, because remember, when you do the thermal scanning, it's only a detection of fever. It doesn't, at this stage, the employee or the visitor hasn't been diagnosed yet. So as far as the employee is concerned, I suggest the employer then refer to the NICD's webpage, and those prescriptions will be on there for them to follow.
Also on the NICD webpage is also the basic PPE, which will be updated as we learn about the current national tight lockdown being lifted quite so slightly on the 1st of May. All the info that will be gazetted, we will email to you, and we have details of all your emails. Thank you so much for joining this conversation. Natie Kroukamp is our health and safety specialist. Natie, you've also compiled a manual. You mentioned earlier that documentation is very important. Can you just explain to us quickly with regards to risk assessing? What is the requirements of a risk assessment and why is it necessary?
A risk assessment is basically a guideline which tells, if you use it properly, it's actually a very helpful document, although many companies see this as a very difficult thing to achieve. But in essence, it's a systematic and a logical process that you follow to identify what hazards. And in this case, remember, we are talking about infections. We're not talking about any other hazards or risks. So to identify a place or, an area or an activity where this infection could take place is the first thing to do. The second thing is what would be the consequences, and in this case, we know what the consequences are. We have all become experts, in fact, if we watch CNN in the afternoon following the Governor Cuomo's briefings. The next thing, of course, who will be affected? In this case, if you look at your employees, of course, how many of them are in a department? What are they doing in that department? And then the next thing will be categorizing the risk. Is it a high risk area? Medium risk, low risk? And from then you will decide what mitigation strategies you will follow. In other words, are you going to use gloves? Are you going to use masks? Are you going to use shields? In other words, face shields, and also the standard of those PPE that will be required. Sanitization, for argument's sake, what sanitization will you use? Or disinfection. Sometimes, after considering that these workplaces have been locked up for at least 5 weeks, a deep cleaning may be necessary, as simple as that. Washings with water and soap.
Natie, just to get back to a question of one of the subscribers, Brian Leary, I want to get you a question quickly and just want to add on the Occupational Health and Safety Act, not the Mining Health and Safety Act. We're just dealing with businesses opening here. If you're in the mining sector, please just drop us an email so we can assist you with regards to that as well. But in terms of the OSH Act or the Occupational Health and Safety Act, an employer may refuse to grant access within reasonable doubt, which he suspects that one of the employees were submitted to infection and have an infection. Then again, that employee needs on his or her own expense go and verify that it is a negative test result for him or her to obviously get back into the workplace. We are looking at a ratio where we want to protect the whole workforce, your business being protected from closing down. And then getting back to Brian Leary's question, he says he's a small business owner with less staff than 25. And he says also, I've ordered thermal scanners or a thermal scanner, and all my staff will wear masks, as well as all of them having face screens. I've also put various sanitizers all over the workplace, as well as compulsory when you work or walk through the door. He wants to know if that is enough. Natie, can you answer that?
Every place will have its own peculiar requirements, and it may. If I listen to that, yes, it may very well be sufficient. I think what's more important is how you use it, and in this case, to get back to the risk assessments and also the requirements of the HPA. Of course, the business owner needs to make sure that every employee follows and adheres to the requirements. So in other words, you could very well have a situation where you have all these PPE and the disinfectant material, but they don't use it properly, or they don't use it at all, or they use the masks and they dispose of it in an incorrect manner, where it now, of course, can expose or disinfect other work areas as such, or somebody.
Louis Pretorius also mentioned here in the comment section, and please have an interactive session with us. He also mentions here that clients need to sign in. They've got to register in the front office, full names, contact details, ID numbers, international visit the past 6 months. That's very necessary. Louis, thank you so much for also bringing that up. And I just want to reiterate that the question also from one of the subscribers, can employer compel an employee whom he reasonably suspects of having the COVID-19 infection, can he permit or refuse them entry to the workplace? Most definitely. And the employers, that falls under legislation with regards to the National Health Act 61 of 2003, with the regulations relating to surveillance and control of notifiable medical conditions. That was also published in the Government Gazette on 15th of December, 2017, and it also was well referred to in cases right across South Africa as the 2017 regulations that needs to provide that a carrier or case of a notifiable medical condition listed in the Annex A, which will also be added on your email if you need the information, him or herself must subject themselves to further medical examinations to clear up all uncertainty with regards to infection. And also, Natie, we want to reiterate, when employers have employees working in different areas as well. You've mentioned earlier high risk, medium risk, very high risk areas, and you also want to keep everyone safe. If they've traveled and went to go see some customers, that also needs to be taken under the loop.
Yes, it did. Within the workplace itself, of course, you may have an area where your clients are, like for argument's sake, your cashier area, or they are buying parts, or it's a shop. Trying to keep the employees in that area limited to that area only, and not let other employees, for argument's sake, working in the admin section to come into that area. So within the workplace, it's important to keep the areas segregated. Outside the workplace, of course, is a little more difficult because you don't necessarily have control over what happens if your employees, for argument's sake, work on a service on a client's premises. It's important to know what the requirements or the health and safety standards of the client is. He may perhaps not take this as serious. So you may decide then not to send your employees to work in a place like that, or the client's standards could be higher than yours. Then you may have to adjust to the clients, because again, your client could now be the one that says, look, I can't accept you on my premises because you are not properly equipped with PPE, or whatever the case may be.
There's also the question, Natie, and I just want to address that question quickly. Does the employer have to pay for staff COVID screening tests? No, there is no obligation on the employer to actually pay for those testings. You're under no obligation. An employee who gets refused to the workplace with regards to a reasonable suspicion, or a suspect that you reasonably suspect an employee being infected with the virus, needs to go to a clinic or to the hospital or local doctor. Having blood tests or the swab, as we got to know it, if it's available, then obviously they need to come back with a positive or a negative result, and ensuring you of that positive or negative result before entering the workplace. Marius Botha also asked what would be an effective method to control suppliers that do deliveries. That's a good question. Would we have to screen them with a thermal instrument and keep a separate register? Before you answer that, Natie, I just want to have people taking notice. To have a thermal scanner is very, very handy, and it will be a great asset and a tool in your toolbox in preventing the spread of the virus. But I want to suggest that it is not an essential piece of equipment needed to open business or convey business. So there are a lot of people who have been trying to get hold of thermal scanners. But a good question nonetheless, having people who does deliveries at your workplace, how do you safeguard that? What is practical tips you can think of, Natie?
Hello, Marius. Yes, it's a good question. The same procedure should, because remember, your suppliers are essentially in the category of visitors, like your customers. But I think what you are trying to allude is that they would come through another gate or another door. The idea is, first of all, to try and, especially if you have limited scanners, like Jan-Hendrik just said, it's a very expensive piece of equipment. But if you are using scanners, then either then have more than one, or arrange that the scanner be taken to the gate. If you are not using scanners, make sure that you have got the register updated of those people, then stating that I am okay, I don't have a fever, I haven't been in contact with anybody that is infected. So that is essentially a risk assessment of people coming on board. And of course, sorry, Jan-Hendrik, the equipment that they bring on board, have you sanitized and disinfected the equipment that you bring on board my premises? If they can't guarantee you that they've done it and you want them on board because they have work to do, then the business owner have the choice to decide whether he's going to facilitate that equipment will be sanitized and disinfected to his standard. Does that answer your question?
Most definitely. Also, Clifford asked here, can we stop workers from going off the premises during lunchtime? For example, can we insist that they bring all their food from home? Clifford, you not only can insist, you are actually obligated in a certain way. Employers are required, with regards to the Occupational Health and Safety Act, to take precautionary measures to protect the workplace. It's also been regarded as the World Health Organization's recommendations that we adhere to the recommendations about communicable diseases. So given the known transmission vectors of COVID-19, highly infection transmission, and taking into account that the measures recommended by the World Health Organization, South African employers should and are legally obligated to implement these World Health Organization recommendations and any other practical necessary measures to ensure that employees are not exposed, the public is not exposed, your customers are not exposed to infected environment, and that I will foresee as the main obligation before opening business. So I hope that answers your question. I just want to, before I answer Johan's question or John's question, I just want to get back to the obligation with regards to the cleaning, sanitizing, and also with regards to that. Is there different specifics? How do I know when I'm cleaning? How do I know when I'm sanitizing and sterilizing? What are the requirements there, Natie?
Okay. To start off with, before you start running the business again, like I said earlier, the place has been locked for at least 5 weeks. So my suggestion is that the people would start washing ordinary water and soap, and if necessary, have a deep clean. And if you're in an area which you suspect that you may need to have sanitizing or disinfecting sprayers coming on board, and then spray the whole workplace or certain areas where you expect to be high risk. So the washing is the first action. Bear in mind that some of these disinfecting properties do not actually sit on or will not serve any purpose if it's laying onto already dirty surface. So it needs to be cleaned first for that disinfectant to do its job.
I just want to move along, Natie. We can definitely go into more depth with regards to cleaning, sanitizing. You would suggest that you get a proper sanitizer. I think a question we also had from one of the viewers were that it's an expensive part of the essentials in reopening from a level 5 lockdown to a level 4, a slight ease of the lockdown, and but an essential part nonetheless. If you do not have the finances to facilitate this, it'll cost you a price to open business as from the 1st of May.
I'm afraid so, yes. I think, if you put things in context again, remember the enemy is an infection. And very often, as expensive as this exercise is, if you have an infection taking place because you allowed an infection to come onto your property unchecked, it may cost you a lot more than that material.
Definitely. I want to cover sick leave entitlements. Before I do that, Natie, there is a question with regards to it's Jean saying that can anyone propose a sustainable testing company or agent to do full COVID-19 testing for all staff and before opening of activities? Are you aware of any companies who do that testing and screening? And I want to add to that question, Jean, that we might have employers or businesses, car washes, or any cleaning services currently online, most probably, that wants to know if they can broaden their business. There might be a gap in the market now for taking up a cleaning service and a disinfecting, sterilizing service. Natie, how does one get involved and what are the legal aspects with regards to covering the whole risk assessment? Do you have to be a health and safety officer, or is a risk assessment just a precautionary measure where you get someone that worked through the manual you just wrote and can convey this testing, keep the documentation in place, and also have or present a cleaning service? Because most of the employees are not qualified to clean. That'll really bother with productivity as well. What are the legal, from a health and safety perspective, the obligations with regards to doing a risk assessment and making that legal for the inspector when he comes to do his inspection?
Jan-Hendrik, and welcome to Jean. The answer is yes. If you feel inadequate or you don't have the necessary skill sets, or perhaps you're doing something which you know that you don't have enough people to do this. It may be a big place, but a small number of people doing so, then I would definitely suggest that you get a contractor in to come and do it for you. Remember, again, when you do your risk assessments, this is where you will establish, listen, I can't do this on my own. I need somebody to help me. When you appoint a contractor, of course, then this opens up the previous discussion where you need to vet the contractor and let him show you what training has he got, what makes him competent to perform those duties. So a bit of due diligence will be necessary from the business owners there, not to just appoint anybody.
And with regards to training, Natie, what do you suggest?
The training would be mostly specific to what type of material. In other words, are you familiar? And in this case, you would ask the person who's going to do the cleaning, show me the material safety data sheets that of the material that you are going to use, which will tell you what risks, and it will tell you if this person did a bit of homework, if he's properly prepared to come and assist you. There's no specific criteria or qualifications that the person needs to know in this case, but of course he needs to know what the risks of his material could bring onto your property again. What is important, especially if they're going to spray, where is he going to spray? Are there any other areas where the spray could be sensitive to your equipment, for argument's sake, if it's electronic equipment or other chemicals where there could be a chemical reaction. So there needs to be a lot of deliberation in this process if you appoint somebody else. But you will see if that person is suitably qualified or competent to do this job. When you look through his safety file and you look through the contract that he's bringing you, what is he going to do for you? What is he going to spray with? What is he going to spray? And what is he going to do after he sprayed? In other words, if he uses PPE himself, make sure that if he's disposing of his PPE, that he doesn't just throw it. Those people will normally be astute and not fall in that trap, but that is definitely on your premises and you need to check for that.
I just want to answer the question of Piccolomisi Mbike, which states that what is the responsibility of landlords in a multi-business complex in terms of the Health and Safety Act? I would suggest, Piccolomisi, that definitely landlords amongst themselves need to agree on a standard with regards to the centre or the place where they work. I hear, or I think that you're referring to different places or different businesses in one aspect, and definitely you need to prevent cross-contamination. You need to treat the situation as hostile. You need to be very preventative with regards to the situation there. With regards to landlords, there was also a legal question being posed earlier this week with regards to landlords in a flat setup in a complex where there are different people renting and also participating in also those situations. And the question is, if you want to know if somebody is infected, you need to do something with that information. So ask yourself as an employer or a landlord the question, what do you want to do with the information? If you have that information, you have to now deal with that information. So make sure you have the right the idea of what to do with that information before you ask that question. I want to get to the sick leave entitlements, but I want to answer Rihanna Zinn's question, which states that she asked, please confirm the temperature that indicates referral to COVID screening testing, please.
Okay, that temperature, the normal temperature for a healthy person is between 36.5 degrees Celsius and not more than 37.5 degrees Celsius. So anything higher than 37.5 degrees Celsius is considered to be feverish.
Good. We want to answer all your questions, and I'll leave some time at the end. We've got 20 minutes left. So let me cover quickly with regards to the sick leave entitlements. So if you look at your Basic Conditions of Employment Act, Section 22 of the BCEA, the regulation of sick leave entitlements says that during each sick leave cycle, the employee is entitled to an amount of paid sick leave due to the equal to the number of days that the employer would normally work during a 6-day period. So according to your Section 23 of the Basic Conditions of Employment Act, an employer is not required to pay an employee sick leave or entitlements if the employee has been absent from work for more than 2 consecutive days or on more than 2 occasions during an 8-day week period. And then also the employee does not provide the medical certificate. Also, there is no paid sick leave with regards to that. Therefore, so while an employee is in quarantine and being treated for COVID-19, it is very important to remember that as prescribed by a medical practitioner, that only states the quarantine. You cannot choose to go into quarantine yourself. With regards to the opening of business now from the 4th, you'll be eligible with disciplinary action if you are urged to work, if it's necessary and essential that you be at work. You cannot choose, you will do so with no work, no pay. That is the reality that employees will be facing. But with regards to your sick leave, an employee is in quarantine only when a doctor places him in quarantine, as prescribed by a medical or medical practitioner, and the employer is required to pay the employee's salary for the period of that sick leave, just in normal circumstances as it would as well. So if the employee has not provided the medical certificate or self-isolated at their own choice, the employer will not be legally entitled to allow the employee to take that sick leave, and could direct the employee to either take or either paid annual leave to use that by discussion. You have to agree with that, and also the unpaid leave for this period is also coming into play. Natie, just getting back to some of the questions, Herman also asked here, understanding that every business would have their own risk assessments done and implemented. What, however, is the legal requirements in an event of being inspected by an official? And I want to add that question to Audrey, who also, is it Audrey? I think it's Audrey or Vanessa. Vanessa Randon, who also asked, who will be inspecting. So with regards to the Occupational Health and Safety Act, only post an infection or post injury, you will have the inspector coming out from the Department of Labour. They have various inspectors coming out and checking if your paperwork is in place, if all your risk assessments, your data sheets, everything Natie has written about in this manual, which we will give these details as well at the end of this viewing. We will have that available, and that needs to be in place when an inspector from the Department of Labour does come knocking at your door with regards to an incident. Because remember now, it is not just it doesn't just involve your business. It involves the whole community where your business is situated. So you can just imagine by yourself the huge impact of the level 4 lifting that we are facing the 1st of May. You as an employer having a huge responsibility with regards to the legislation, keeping the environment safe, keeping your employees safe, but most of all, keeping yourself and your staff also safe, as well as the public. Natie, can you just maybe just reiterate the question here that I have from Letwin Nkube? He says, as a landlord of a commercial building where different tenants resides, what measures or responsibility does the tenant and the landlord have to put in place to avoid infections? I think we've covered most of that. It definitely will be covered in more detail. We will send you some notes of the highlights of this conversation. We need to understand that there is definitely obligation on the employer, and we're talking about an employee-employee relationship at the moment, but it comes into play as well that the obligation is for everyone to keep and stay safe and have everyone within regards to what they are extended to their business. And Natie, maybe you can just give us some hints and tips as well. When you're working from, you're doing some outside work to a customer's premises, how would you go about conveying those health and safety aspects in the regulations of the HBO?
Okay, first of all, I'd like to just touch on that and maybe just add to what you've already said about the relationship with a flat owner and the tenants, for argument's sake. Remember, the definition of a workplace includes property, and in this case, the owner of the building happens to attract the definition of for a business owner. So therefore, he's an employer, and the relationship that is in this case, as far as the building owner is concerned, all the communal areas where the various tenants will share, that will be for the responsibility of the owner. And then, of course, the areas which is demarcated as that of the responsibility for the tenant, not only will the tenant be liable or required to ensure that his safety or lack of will not affect his neighbors, for argument's sake, but in this case, the same as you mentioned earlier, where the employer can force somebody if that person's activities or his mannerisms could be a problem for other people, and in other words, disrespecting the health of other people around him. But sorry.
No, definitely, Natie, it's very important, the fact that we need to keep everyone safe. I want to just jump right in. We've got, I think, 14 minutes left, and I would hate to see you as an employer opening yourself up to unfair dismissals. That will come into play as well. So let me answer a question being asked here on air. And the question is, can an employer dismiss an employee who has contracted the COVID-19 infection on the basis of a medical incapacity? So what you're dealing with here is the Labour Relations Act, which guarantees an employee the right not to be unfairly dismissed. We are well aware of that. But or unfairly dismissed as well as being subjected to unfair labor practices. So according to the South African employment law, one of the reasons of an employer unfairly dismissing an employee would be the basis of income, or fairly dismissing an employee would be the basis of incapacity, the ability to contract your work. So the Code of Good Practice for the dismissal in Schedule 8 of paragraph 10 of the Labour Relations Act provides the principles dealing with a dismissal due to ill injury or illness, ill health or injury, and the incapacity renders the employee temporarily unable to work, and the employer should investigate the extent of the incapacity. You want to make sure that it is a permanent incapacity and not a temporary incapacity before you have a hearing and getting some labour experts to do the dismissal. And if the employee is likely to be absent from work for a period that is unreasonably long, so there's also the test of a reasonable man, and the employer should then investigate all positive alternatives. The Act also prescribes that it is very important, as you look at court cases and the cases at hand, you will see that you need to exhaust all measures to find a way, especially in the current economic circumstances, not to dismiss. But if an unreasonable time is at hand, obviously we need to have the Act also protecting those employers and consumers, and definitely will have effect with regards to dismissal. So the employer should investigate all positive alternatives, and the period of absence, the seriousness of the injury, the illness at hand, and dismissing an employee merely because he has infected with COVID-19 is likely to amount to an unfair dismissal. So I want to warn you with regards to that. You need to temporarily maybe suspend him, have him subjected to testing, have a doctor coming back with a certificate conveying and positively confirming that this person, the employee, is not infected with COVID-19 virus. And so you definitely have different legislations in place which protects you as an employer, definitely your business as well, but also having a look at the welfare of employees. Good. So I've got a question as well, Daniel Howe, asking what was posted by the Western Cape government, and can it be used for a register or a questionnaire for all employees, customers, clients who enter your premises? I haven't seen that post. I would like to have a look at it, so we can probably get back to you on email. Thank you so much for asking that question. John also said we need to ask him or add him to our email list. You are on the email list. We'll definitely get back to you and facilitate our communications with you. Gail Gerber asking, how do we know which businesses are allowed to go back to work on the 1st? Gail, that's a very, very good question. And having a look at the tight lockdown, the national lockdown, as we having a look at it now, there will definitely be made some restrictions with openings or the business opening from the 1st of May. We'll definitely have more clarity when it gets gazetted by the president of the country. And definitely we had a look at some of the aspects there. I can just open up that file and have a look for you, but we'll definitely summarize the businesses opening. We'll definitely see hot food being sold at restaurants, but not in-house. You will have deliveries. That was one of the things. You will have some of the mines opening, but not to full capacity with regards to customers. Maybe you can just give us a list of all your businesses, and we can just confirm if that will be open from the 1st of May. I think that will be a more practical approach with regards to this. In Letwin Makube also asked the question here. I think we've answered that. Sorry. Yolandi Flemings, where do you report an infected person should you come across the situation? It is an obligation to report it to the healthcare facilities with regards to your municipality. You can also report it with the police, but we'll also add a telephone number which you can just WhatsApp or you can message it. There's also an email address. Your obligation, please keep in mind that your obligation to report any issue with regards to infections and opening you up for a legal dispute, so I'm going to just keep that with regards to an employer-employee perspective. You are under obligation to definitely report that. But when you report it, please make sure that you document it as well. So, Natie, thank you so much for compiling that. manual. We do not have enough time to go through all the details, data sheets, and everything that needs to be covered with regards to the manual. But that manual in hand, will that equip you to conduct business as a cleaning facility? And will that be a legal safeguard when you do open your business, that you have covered all the points? Can you guarantee that for us?
Well, again, the cleaning facility will be, in this case, you can look at it as a service provider or as a standalone business owner. So I think if I understand you correctly, if you are running a business as a cleaning cleaning company, yes, this is a very let's call it a straightforward, it's a simple and a systematic process. The file will take you through a policy and then run through all the requirements which is stipulated in the regulations for the hazardous biological agents. If you, and of course, with it are checklists that you can use. There's a very simple checklist that you can use before you open up. One for after you've opened the doors, in other words, maintaining the status quo of a healthy workplace, and also a checklist for the business managers to, when they do the walkarounds, to make sure that everything is okay, including hygiene, the PPE requirements, the risk assessment. It takes you through all the processes that you are required. But it's like a toolkit. In other words, there are documents that you can physically use and fill in, including the point which one of the subscribers mentioned, the register.
So a very good question from Clifford as well, asking us, how exactly do I determine which is my sectoral determination? So Clifford, you have opened your business, you have contracts in place. That is with regards to the current legislation. There is the basic conditions of employment, the act there, which have sectoral determinations in what sector are you busy operating. That'll be, everything will be situated under that act. For instance, you will have wholesale and retail as a sectoral determination. And once again, you can just tell us the nature of your business. You can just email us or give us your details, and we'll definitely put that in place, and we can have a look at your contracts as well if you would like us to do that as well. So that also determines your sectoral determination. It also helps with your minimum wage, how the sector you are working at or working in will also be handled with regards to wage issues. So it's quite important that you know what your sectoral determination is, and that all gets implemented with regards to the Basic Conditions of Employment Act. I hope that answers your question. We are wrapping the session up in 5 minutes' time, so I want to encourage you to ask your questions. There's also Tumelo Hendricks, who says he's back online. I'm glad to hear that. Stefano, sorry we lost you there for a few seconds. Go Gerber also says, will our staff require movement permits from the first? The requirements and the restrictions and the opening of level 4 will definitely be set out by the president. We will see that with the info getting gazetted, the restrictions, the prescriptions, and also under the conditions which we are opening. We will definitely keep you posted with regards to that. My experience with regards to that and is that we'll definitely need permits to move in and amongst. You will have your workers definitely having a permit, and we can also help you with that. We have a website which can facilitate that permit for you and give you the guidelines with regards to that permit. We are operating currently with essential services with regards to that permit. You will see that getting more into place. You will see on the 1st of May how the president also subscribes everyone to be obligated and have everyone being obligated to do the necessary to prevent the spreading of the virus, flattening the curve. I think that is the main aim. And you will have a legal obligation as an employer to also assist. If you want to take your business and you open it on the 1st, if you are allowed to open it on the 1st, most essential businesses with regard to clothing companies will be eligible to open. We also heard that a few training arrangements have been made, but no organized training. I think that is quite important. Also gatherings with less than 10 people, which comes back to each and every one of your questions. Having a staff of 25 people, how will that affect my situation? And so we'll have a look at that. Restrictions are not yet clear. There are a lot of proposals, a lot of drafts being made at the moment, but we'll definitely have that clear when that gets gazetted. And as a labor law company specializing in labor law for employers, we would gladly assist you. Thank you for subscribing on this channel, and we'll definitely get back to you via email. Mark Tolsma says, hi there. Will there be some info for the service industry? Definitely, where your employers can go out to clients and do repairs. You will have to keep them safe, Mark. A very, very good question. And that is your obligation. The Occupational Health and Safety Act places you under eligibility to keep that in place. And Natie has covered that very, very good in this manual. Natie, will people be able to contact you and get the manual from you? I think that is some of the all of the questions that have been asked here gets answered in your manual. The procedures gets answered in your manual. Very handy tool, I think a necessity. So I just don't want to sell the manual. We just want to have people.
Thank you. No, the questions can be answered through the job law, since we are an alliance partnership. And I would like to suggest that the questions just be raised through the web page, and we will address every query or inquiry on a one-on-one basis.
I'll let you get your phone and just maybe put that on silent. Thank you, Natie.
Yes.
Getting back to the question from Richter van Reenen, and the question is very good. He's asking, is there a list? Is there a list of eligible companies that can be used to disinfect the workplace? I think that's a concern, Natie, and that's why you've also compiled, it's not your first manual, but especially with the SARS-CoV-2 strain and the infection with regards to that, safeguarding your business, there are business opportunities with regards to that, and definitely if you comply with regards to the legislation and also with the risk assessment, the whole data sheet issue, there's a whole lot of paperwork that needs to be covered, but also training and consultations that can be implemented. I don't think as of yet there's a list of companies that does sanitizing, cleaning. I think this situation is being quite under-iterated. If you think about it, we are opening on the 1st of May. People are worried about which businesses will be opening. I think the focus of the president will definitely be that we will open, but then being implemented by the health and safety aspects. We are closing this up. We are out of time. Thank you so much for joining each and every one of us. Thank you to my co-host, Natie Kroukamp from Safety at Work. Natie, thank you so much for joining us. We really appreciate your time. As for myself and the company Job Law, please go and visit our website at www.joblaw.co.za. And thank you so much for the technical team, which will get back to all your questions, the highlights, the highlights of this meeting. And we appreciate the time that you spent with us. And we hope we could facilitate something in the future as well. Thank you.
Thank you so much. Bye-bye.